Hi guys, today we are going to be talking about the structure. But before we proceed, apologies for the background noise. Yeah, so this structure right here is our liver. As you can see, a very large organ, the largest organ inside the body, but not outside the body. In the whole body, it is the skin, but the second largest organ in the whole body is the liver. So this is our liver, the second largest organ in the whole body, and we have several surfaces, we have several borders. So the surface are five surfaces. So we have five surfaces. This right here is our anterior surface. This is our superior surface. This is our right lateral surface because the liver is more on the right. This is our posterior surface, and this is our inferior surface. Right? So superior, anterior, right lateral, posterior, and inferior surface. So we have the lobes of the liver. The lobes of the liver can be anatomical or physiological. So in terms of physiology, it's just the function. In terms of anatomy, just basically the lobes. So anatomically, we have two lobes of the liver, or normally we have two lobes of the liver. So anatomically, our caudate and our caudate lobe belong to the right lobe of the liver, while physiologically, the caudate and the caudate lobe belongs to the left lobe of the liver because the arterial supply, the biological origin, they all arise from the same biological origin. That's why physiologically it is left lobe. They belong to left lobe, while anatomically they belong to right lobe. Now let's identify these various lobes. We have these are left lobe, these are right lobe. This right here is our caudate lobe, and this right here is our quadrate lobe. Caudate lobe, quadrate lobe. Left lobe, right lobe. Now, what separates these lobes? We can see this structure here that separates or demarcates the right lobe from the left lobe anteriorly. So this structure here is our falciform ligament, of which we'll talk more about very soon. And posteriorly, what demarcates it is our fissure, our left hepatic fissure. We also have the right hepatic fissure, and we have the portal hepatic, which is also known as the horizontal fissure. Right hepatic fissure, left hepatic fissure, and portal hepatic. Now let's talk about what is present in each of these fissures or the grooves that they contain. So more to the right, we have IVC, and more to the left we have our aorta. So because of we have IVC more to the right and this is our right lobe, this area can be painted, and maybe peradventure this structure has been removed. As you can see, this is a vessel, a large one at that. So this is the IVC. So if this structure, this vessel, if it has been removed, the IVC, if it has been removed, and this area is painted, this is our groove for IVC. Then below the groove for IVC is our fossa for gallbladder. Had it been this gallbladder is not present, so this area, if it's painted, is the fossa for gallbladder. Then on the left hepatic fissure, the upper part close to the caudate lobe, we have this structure that I can bring out. It is often pinned in steeplechase. This structure can be pinned, can be tied, and this is our ligamentum venosum, initially called doctor's venosum in fetal life. Be sure to watch my video on fetal circulation to know what it does in fetal life. So this is our ligamentum venosum. Then below the ligamentum venosum is this structure that is protruding out, and this is our free border of the falciform ligament, also known as the ligamentum teres hepatis or the round ligament of the liver. And this is obliterated umbilical vein, left umbilical vein to be specific. So obliterated left umbilical vein forms the ligamentum teres hepatis, while ductus venosum forms the ligamentum venosum. So here is our groove for IVC, here is our fossa for gallbladder, here is our ligamentum venosum, and this is our round ligament of the liver. Then anteriorly, we already mentioned this before, this is our falciform ligament. This structure can be pinned or tied, and you can be asked what it does or what it attach or what it connects. So basically it connects the liver to the anterior abdominal wall. So the falciform ligament connects the liver to the anterior abdominal wall. Now let's talk about other ligaments of the liver. Apart from the falciform, the ligamentum venosum, the ligamentum teres hepatis. Or we should also note that we have our true ligament, we have our false ligament. The true ligaments are ligaments, while the false ligament are the ones that arise from peritoneal folds. So, falciform ligament is a peritoneal fold ligament. Another ligament now that we have on the liver, we have the coronary ligament. And from the name coronary, crown or meaning crown, it surrounds the liver like a crown. So it surrounds the liver like a crown. And we also have our right and left triangular ligament. The left and right triangular ligament are just extensions of the coronary ligament. So on the left lobe, we have the left triangular ligament. So this sort of triangular structure that we are seeing is our left triangular ligament. And on the right lobe, we have our right triangular ligament. So this right here is our right triangular ligament. We should also note our bare area of the liver. So the bare area of the liver is located on the posterior surface. This is our posterior surface of the liver. This area is our bare area of the liver. And by bare area, it means it does not have any peritoneal attachment. It's just bare. It's in direct contact with the diaphragm. So this is the bare area of the liver, and this is our coronary ligament surrounding the liver like a crown, our left triangular ligament and our right triangular ligament. So let's go to the impression of the liver. Apart from our fossa and our groove and our ligamentum venosum and hepatis. So we know our stomach, the anterior relation is our left lobe of the liver. One of the anterior relations of the stomach is our left lobe of the liver. So the stomach is J-shaped. So we're going to see a J shape in this area. I want us to have an easy way of identifying it. So if I'm drawing a J shape representing the stomach, so this right here is our esophageal impression of the stomach. The esophageal part of the abdominal part of the esophagus is here. Then this right here is the gastric impression. The whole of this place is gastric impression. Esophageal impression, gastric impression. Then the stomach continues as what the duodenum. So right here is our duodenal impression. Again, esophageal impression, gastric impression, and duodenal impression. Then on the right lobe, we have this area here, and this is our renal impression. We can see it's well defined, and this area can be painted, this area, any place can be painted. However, if this area is painted and we have been able to identify that, okay, this is the right lobe. So this right here is our renal impression for the right kidney. Then below the renal impression is our colic impression for the hepatic flexure or the right colic flexure. So this is our colic impression, our renal impression, gastric impression, esophageal impression, and duodenal impression. And do well to know the segment of the liver in terms of essay questions, but not specifically steeplechase. So let's go over the liver and the likely things they can ask. So this right here is our falciform ligament. Falciform ligament. The free border of the falciform ligament is our round ligament of the liver, or ligamentum teres hepatis. Then posteriorly, we have this right here between the left lobe and the caudate lobe. This is our ligamentum venosum. Then between the right lobe and the caudate lobe, we have our groove for IVC. If the IVC is removed and the area is painted, this is our groove for IVC. But then this structure right here is the IVC. Then below the groove for IVC, we have our gallbladder, our fossa for gallbladder. So this is our fossa for gallbladder. Then we have our quadrate lobe, caudate lobe, and we have our ligamentum teres hepatis. We should also note the structures at the porta hepatis. So this is our porta hepatis. The porta hepatis contains portal triad, and portal triad comprise bile duct, upper hepatic artery, and portal vein. The largest structure amongst all this is always the portal vein. So if this structure is pinned, it is the largest among all this that we are seeing. This right here is our portal vein, the largest. Then we have our artery, Then we have our duct, our artery and our duct. And also know the extramedullary apparatus in terms of essay questions, and also the triangle of Carlos in terms of essay questions. So this is all for the liver. Five surfaces, know the weight of the organ, know the embryological origin of the organ. The embryological origin of liver is pars hepatica. So pars hepatica, this structure right here can be paid. You can be asked for the the capacity, and the capacity is 30 to 80 mils. So the gallbladder, the capacity is 30 to 80 mils. The embryological origin is pars cystica. So pars cystica give rise to gallbladder and cystic duct. Pars hepatica give rise to the liver proper. And that's basically all for the liver. Bye for now.